Hi there, Dr. Postma here. And in talking about testosterone, I think it's also important to talk about um, prostate health, and also one of the things that we often have to check for is PSA, and that is it stands for prostate specific antigen, and that is a marker for prostate health, but also prostate cancer. And usually, um, we typically won't test PSA until like men get in their 50s. But when someone is prescribed testosterone, that's something that we need to be checking more regularly, as testosterone can increase PSA. And so that's something that it brings up a whole other conversation, because PSA can, while it's a marker for prostate cancer, it can increase in a number of other ways besides prostate cancer. And with PSA increasing, one of the things that we have to like discuss in more of an informed consent with our patients is that there's a fair amount of men that will end up getting prostate cancer, and there's different types of prostate cancer, right? And so some of them are the least aggressive, and that's what most men will end up dying from. And then there's some more aggressive forms of the prostate cancer, and those are the ones that we really need to be aware of and to track. So there's some, I guess, differences in opinions around testing for PSA and testing it too early and too frequently, because in some cases it may be elevated, and men may have more of a least aggressive form of the prostate cancer. And what we find is that most men that, like I said earlier, that die of prostate cancer will die of the least aggressive form. And so, but what ends up happening is that they'll die of other causes, and more so than the prostate cancer itself. And so there becomes more of an ethical question, around testing PSA. So I just wanted to mention that around, testosterone prescription and prostate health, and that's something that you have to consider and talk to your doctor about. And yeah.
Shawn, do you still recommend doing a PSA test at this point for your clients then? I know there's debate on whether we should be doing it at all. I still do.
Yeah. I think I usually wait, until men are at least 50. If they're doing testosterone, then that's really not a question. Then I'm absolutely checking for PSA. Yeah. And then I also really want to inform them around kind of the risks and benefits of checking for PSA. And I think that's the most important conversation, that there's informed consent, and then I'm not just checking it because I'm a doctor and that I should be, but that, that there are some risks and benefits around it. And sometimes when men get the elevated PSA back, then that kind of brings on a whole other level of testing that is required in it, and it can open up a different, can of worms, so to speak, unnecessarily, and may not be necessary.
All right. Well, thank you for sharing on that topic. Appreciate it. It is controversial now, I think, because the U.S. Preventive Task Force has recommended against. But I've ran it on someone, and they came back in the PSA over 100, and it's like, oh yeah, that's definitely some sort of aggressive cancer at this point. That was the only way we found it at that point. But yeah, like I said, I think like you said, I think that there can be often times where people are put on or unnecessarily go through a whole lot of interventions because of a borderline elevation PSA. And I think that's what the task force is trying to prevent happening. So, all right. Thank you for sharing, Dr. Postma.